Thanks, Mike. Good afternoon, everyone. I want to start today with some very welcome news. Certain Free Library of Philadelphia locations will reopen for limited in-building services starting a week from today, Tuesday, January 19th. Throughout the pandemic, the Free Library has been open, providing services virtually and using contact-free materials for pickup. Resuming in-building services allows us to expand those services within our communities. And I know the Free Library staff is excited to welcome patrons back for vital services. This includes being able to borrow and return materials, reference desk services, and more. It also includes access to computers, Wi-Fi, and printing. For many Philadelphians, libraries are key points of digital access. The availability of computers and Wi-Fi is always one of our most important offerings and is especially critical during a time of increased use of virtual and digital resources. You can find what services are available at each location at freelibrary.org/locations or by calling 1-833-TALK-FLP. That's freelibrary.org/locations or call 1-833-TALK-FLP. I'm pleased that Leslie Walker, the interim director of the Free Library, has joined us today for questions. Again, this will come a week from today, and I know many residents will be as thrilled as I am to see them reopen. I also want to provide an update on city's meal distribution efforts. Over the last 10 months, student meal sites have distributed over 6 million free meals while school buildings remain closed. We are grateful for the efforts of the School District of Philadelphia, many charter schools, and other partners to ensure that our students have reliable access to food during the pandemic. This week, we are excited to announce that the school district has expanded the number of distribution sites to include 39 new locations. That means there are more than 100 schools citywide where families can pick up a week's worth of student meals each Friday. I'm so glad the families will have even more options and better access to free food thanks to this expansion. Remember, students don't have to be enrolled at a specific school in order to pick up meals, and a student ID is not required. To see the new sites and confirm schedules, families should call 311 or visit phila.gov/food. And finally, as you know, Martin Luther King Day comes next Monday. With the pandemic still raging across the globe, this will be an MLK Day unlike any other. Here in Philadelphia, Girard College will serve as the region's signature project site. Among the many activities is COVID testing. Global Citizen, in partnership with the Black Doctors COVID-19 Consortium, is leading drive-through and walk-in testing at Girard College. This will take place on MLK Day, Monday, January 18th, from 9 a.m. till noon. This testing will specifically target underserved communities. And in the spirit of Dr. Martin Luther King, physicians, nurses, frontline workers, hospitals, and citizen volunteers will assist in the testing. We'll also be holding virtual trainings for those interested in serving in the Medical Reserve Corps. It's not too late to sign up for that. Go to mlkdayofservice.org for more information. That's mlkdayofservice.org. And now I turn it over to Dr. Farley for his update.
Thank you very much, Mayor. We are seeing indications of increases in coronavirus infections from the holidays. I'll update you on that, as well as updating you on our vaccination work and our plans for future vaccination, and then updates on our safer at home restrictions. First, though, the numbers. Since this time yesterday, we've identified 637 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total number of people with confirmed infection of 98,215 since the beginning of the epidemic. In addition, we have 181 new probable cases diagnosed by the rapid antigen test. Now, those numbers are high today in part, as with previous Tuesdays, because we've got a very large number of laboratory testing results today, over 15,000. Now, to put in context, for past week, January 3rd to January 9th, we averaged 584 cases per day. That's the PCR test and the rapid antigen test combined. And so far, we expect more with delayed reporting. And of those people tested, 8.6% tested positive. Now, the previous week, the holiday week of December 27th to January 3rd, we averaged 491 cases per day. 8.9% of people tested positive. So for this past week, there was an increase in cases, but a decrease in the percent of people who tested positive. So overall, we're about the same, and that's in part because there was more testing done after the holidays were over. Now, that's what's happening in Philadelphia. This is in the context of continued increases in cases all around us. Pennsylvania, New Jersey, Delaware, and the United States as a whole are all seeing fairly substantial increases in coronavirus cases, I believe related to the social gatherings that occurred over Christmas and over New Year's. Now, back here in Philadelphia, what about our hospitals? This morning, there were 616 patients with COVID hospitalized in the city of Philadelphia. And that number has generally been decreasing since mid-December when it peaked at over 900. What about deaths? Since this time yesterday, we've identified 37 new deaths from the coronavirus in Philadelphia residents, bringing us to a total of 2,640 since the beginning of the epidemic. Now, our weekly deaths peaked at 103 the week of December 13th, and it appears to be falling since that time. Now, where are we with our vaccine program? Our distribution is improving, and it's now growing to additional sites. We're still working on phase 1A. That includes healthcare workers and people who live and work in nursing homes. As of this morning, we have vaccinated a total of 50,529 people with the first dose, 50,529. That number is about double the number that I reported last week. And in addition, there were about 9,600 people who received the second dose of the vaccine. Now, this week, we were allocated 9,500 doses of the Moderna vaccine and 9,750 doses of the Pfizer vaccine. Now, we've been told that we're going to receive the same weekly amounts like that through the end of January. But this is important. We have not been told how many doses we will get after January. We have no idea how many doses we'll receive on a weekly basis after January. That uncertainty makes it very difficult for us to plan. Many people reasonably want to know when the vaccine will be available to them. It's impossible for us to know if we don't know how many doses we're going to be getting. Now, last week, vaccinations were continued in hospitals, and they expanded to other sites to reach non-hospital-based healthcare workers. There was, as you may have seen, a mass clinic that was run for healthcare workers at the convention center, run by an organization called Philly Fighting COVID. And they vaccinated about 2,500 people in 2 days. In addition, our partnership with Rite Aid has made vaccination available for healthcare workers at 26 pharmacies across the city. And last week, they vaccinated 1,959 people. And CVS and Walgreens were vaccinating in nursing homes. Roughly 20 sites were visited last week, and they vaccinated in nursing homes 3,732 people. That includes both staff and residents. So that's where we are with vaccination right now. What about the future for this? Well, today we are releasing on our website a listing of the groups that are to be vaccinated in phase 1B and phase 1C. Now, the priority groups that are in those phases were developed by our local Vaccine Advisory Committee. That Vaccine Advisory Committee has more than 40 members, include healthcare experts, and representatives of faith-based organizations, businesses, insurers, social service organizations, and community organizations. The Advisory Committee used as a starting point the recommendations from the Federal Advisory Committee on Immunization Practices, the ACIP. And then they took into account the unique characteristics of Philadelphia. Philadelphia is a big city. We have a large percentage of our population minority. We have high poverty rates. And with that, we have high rates of chronic disease. Now, the Federal Committee ranked for phase 1B what they called frontline essential workers. That's to say, people who are doing essential work who have a lot of contact with the public, and people over the age of 75. And in phase 1C, the Federal Committee recommended other essential workers, people between the ages of 65 and 74, and people between the ages of 16 and 64 who have high-risk medical conditions. Those are conditions that put them at greater risk for severe disease if they were infected. Now, our Philadelphia ratings are similar, but not exactly the same. For phase 1B, the group recommended first frontline essential workers, such as first responders, grocery store workers, childcare workers, and teachers. Then people who live and work in congregate settings, such as homeless shelters and rehab facilities. And then people who have greater risk of severe illness, including people over the age of 75, but also including people between the ages of 16 to 64 who have these high-risk medical conditions, like heart disease and diabetes. And then in phase 1C, they recommended the other essential workers and people aged 65 to 74 without those high-risk medical conditions. Now, the local list differs from the federal and the Commonwealth list in that people under the age of 74 who have these high-risk medical conditions are in phase 1B instead of phase 1C. Why is that? And that's because these medical conditions are common in low-income populations and minority populations. We have higher rates of them here in Philadelphia than elsewhere. It's a more important risk factor here. And this is one way for us to address the racial disparity in COVID mortality here in Philadelphia. Now, within each sub-phase in our listing on our website, the groups are listed in a general priority order. Not a strict priority order, but a general priority order. And because it can take a long time to complete an individual group, we'll not wait to complete one group before starting the next, but it does give you a general sense of the sequence that we'll go through these groups. Now, we expect that we're going to begin vaccinating in phase 1B sometime in late January, maybe the week of January 25th. Now, the phase 1B group is a large group, especially because of those people with the high-risk medical conditions. We'll likely be in this group vaccinating for people for months unless the vaccine production accelerates or another vaccine is approved. But we'll not wait to complete phase 1B before we start phase 1C. Now, we've gotten a number of questions on how the vaccine will be distributed and where people can get it. We don't have all of this worked out yet, but here's what I can tell you today. The vaccine will be available at a combination of sites, similar to where flu vaccine is available now. That includes hospitals. Right now, the hospitals are vaccinating their own staff, but in the future, we'll work with them to establish clinics for others, such as their patients or community members. Then clinics, like our federally qualified health centers, and occupational health clinics for large employers who have such clinics, like the police department or SEPTA. Then pharmacies, as you see, like flu vaccine is available at pharmacies now, and urgent care centers. And there will be on-site vaccination in the congregate settings, such as nursing homes that's taking place now and in homeless shelters. The health department for these congregate settings beyond nursing homes will be putting together what we call strike teams to do those vaccinations on site. Then there will be mass vaccination clinics like the one you saw last week at the convention center. And then there will be some vaccine available in physicians' offices. But note there's going to be some limits on this because it's only if physicians have the proper storage equipment for these very complicated vaccines and have to have the information technology that enables them to report the data on who they're vaccinating to us. Now, the Pfizer vaccine, which needs to be stored ultra cold, can't be used in these physician practices. So this does limit in another way the places that can be offering that particular vaccine. So that's a general sense of where the vaccine is going to be available. Our plans are still being developed. We will disseminate a plan that defines this more soon. And we'll update that plan more as more is worked out. Now, in general, let me say many people are eager to get this vaccine, and I'm very glad that people are eager to get this vaccine. Over time, everyone who wants to get the vaccine will be able to get it. But with the number of doses that we're receiving on a weekly basis, it'll take months for us to get to everyone. So for everyone who's eager, we ask you just to be patient. We'll get to you as soon as we can. For those people who are hesitant about getting the vaccine, and there are many people who are hesitant, this gives you an opportunity to see how others are doing before you get the vaccine. And we have said in the past that we need to combat this winter wave of the pandemic with our existing tools, masks and distance. And that is still true. There's just not enough vaccine for us to make a difference in this particular wave of the pandemic. And we all need to wear masks and practice social distancing for months anyway, whether we're vaccinated or not. Which brings me now to our safer at home restrictions. These restrictions went into effect on November 20th. At that time, Philadelphia's case rates were rising rapidly. Since then, the case rates have fallen 33%. In our hospital census, the number of patients with COVID in the hospitals has fallen by 1/3 from the peak. Now, I'm hopeful that the current increase that we're seeing in cases around the state and to a small extent in the city will subside in the next week. With that in mind, we will back off cautiously on the restrictions effective this Saturday, January 16th. We will allow restaurants to provide indoor dining, effective that date, with seating of 25% of their approved occupancy for seated dining, plus other restrictions, such as a maximum table size of 4 and household members only, because we don't want people mixing with other households in restaurants and passing the infection that way. and that everyone must wear masks at all times except for when they're seated at tables and eating. So they must wear a mask, for example, when they get up to go to the restroom. And the servers must wear both masks and face shields. Now, just to note that this 25 occupancy for seated dining is not 25% of maximum occupancy of a space. The legal occupancy of a space may be much larger than how many people can be seated at a restaurant. So this 25% is not comparable to the occupancy limits we have in other spaces. Now, with this, with all of our restaurants, we're encouraging them to improve their ventilation to reduce airborne spread of the virus. The three things in particular we're looking for restaurants to try to maximize. First, to maximize the percent of outdoor air that is circulated by their heating, ventilation, and air conditioning system, their HVAC system. The more outdoor air there is, the less any viral particles that are in the air are recirculated. Then we'd like to have restaurants have a filter in their system that has an MERV or MERV rating, 13 or greater. And then we'd like to have the system circulate enough so that there are 6 air exchanges per hour or more. To put it another way, that the air changes over in the indoor side of the restaurant every 10 minutes on average. Now that's what we're asking restaurants, not requiring, but asking restaurants to do across the city. But we're also currently working on enhanced standards that would be required for restaurants to have an increased percent occupancy. Now, we're not ready to announce that yet, but we hope we will announce that soon as we're ready. Now, we're also, with this changes in our restrictions, we're going to allow theaters to reopen the maximum occupancy of 10% and a requirement that everyone wear masks and that no one be served food or drinks. Because if you're consuming food and drinks, then you can't wear a mask. So to put this another way, if you're a restaurant, you cannot have entertainment. If you're a theater, you cannot have food, or you can have a theater that's not serving food, but you can't do both. And we're also allowing colleges to reopen for in-person instruction with occupancy restrictions and masks. Now, we will continue to prohibit indoor catered events and indoor social gatherings of any size. But these are social gatherings where people gather between households, and that's how the virus spreads from one household to another. This, we think, is the primary way that the virus is spreading right now, except for when it's within household members. So these are very important, so we're not allowing those to restart now. Now, there's detailed guidance for all of our sites on our website, www.phila.gov/COVID. And with these changes, I just need to remind people, as always, it is possible that we'll reinstitute these restrictions if the case rates rise and if we have reason to believe that the virus is spreading at these sites. Now, one other concern that I mentioned last week, I want to remind people this week. College students will be returning to Philadelphia very soon. In early September, we saw a surge in cases in Philadelphia because of those college students related to social events. We don't want to have a repeat of that now. So we're working with the colleges to try to prevent social gatherings among the students of any size. That's for their sake, as well as the city as a whole. So we're asking college students and universities to take those restrictions very seriously. So what should people do now? Well, remind people that the vaccine, as much as it's great that it's here, will not help us get through this winter wave. We need to use the tools we already have. That means no indoor gatherings, no parties, no inviting friends over, no inviting relatives over, no sleepovers for the kids. Avoid travel, because if you travel, you get to get together with others. If you do get together with anybody, do it outside with masks. When you go out for errands, wear masks everywhere. That's it for today. All of our information is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And as I noted before, we're going to move Armando's translation of Dr. Farley's and the mayor's opening remarks until the end of the questioning at 2 p.m. And we're now going to move directly to Q&A for members of the press. I wanted to point out that today we're again joined by Managing Director Tumar Alexander, and also with us today is Deputy Mayor Cynthia Figueroa for questions on the meal sites. Dr. Caroline Johnson, the Deputy Health Commissioner, is with us for specific questions regarding the distribution of vaccines in Philadelphia. As the Mayor noted, Leslie Walker, the Interim Director of the Free Library, has joined us today for questions on the reopening next week of certain branches. And because of limited time, we ask only one representative from each media outlet to ask the questions and to limit your questions to 3 or fewer. The first round of questions is limited to the topic of COVID-19. If and only if there's time will we go to a second round, and at that point we would be able to take questions on other topics, including matters unfolding in Washington. So please hold them for a second round if there's time. If your hand is raised now and your topic is not COVID, please lower it and we will try to get to you. For now, let's get started with Jeff Cole of Fox 29. Jeff, you're up.
Yeah. Hello, folks. Questions for Dr. Farley. Dr. Farley, the Trump administration today seemed to follow what the Biden team had said earlier, that it somehow wants the federal government, or is urging the federal government, and I guess state governments as well, and city governments too, release larger amounts of vaccine and not hold back, and I guess this refers to the federal government as well, not hold back vaccine for second doses. Biden talked about it. Now it looks like Trump is bought on. Can you interpret that for us and how you see that impacting what you're trying to do?
Yeah, so just to explain to other people here, currently the way the federal government is doing this is that for every dose they ship to us, they keep a second dose at the warehouse. And when those people are due for their second doses, those doses arrive here in the city of Philadelphia. That's to ensure that there are doses around to give people 2 doses of the vaccine, because the vaccines were tested in trials, giving people 2 doses. We don't know how effective it is to give people 1 dose only. So there's a recommendation that instead of those doses being kept at a warehouse, that they be shipped out to local sites. Now, in theory, we have then more doses to give to people. The problem with that is that if we were to administer those doses to people, and we don't have a guarantee of how many doses will arrive in the future, we may have people that we vaccinate with their first dose, and we don't have any vaccine left when they come in for the second dose. So it may help us a little bit, but it needs to be paired with much better information than we're getting right now about how many doses will be produced and delivered to us in the future. I don't want to give out all our vaccine and then have none for the second dose.
Dr. Farley, I think last Tuesday when you briefed, you said that 39% of the vaccine that the city in general had received was in the arms of people who could get it. What's your number like now, and is that improved in any way?
Indeed, it has improved. It's at 55% today, so substantially more than we were last week. And I should point out that the national average, according to data that I saw in the New York Times, is 33% this week. We're at 55%. The percentage for Pennsylvania and New Jersey are about 33%. So we are well above the national average. And according to data the Inquirer put together in a story the other day, we're higher than the other major cities that are getting direct relationships with the CDC, as Philadelphia is. So we're doing far better than the nation as a whole. We want to do better still, but we absolutely have improved them overall compared to our peers who are doing well.
Last question I have for you. You've raised this concern about no idea of the amount of vaccine you'll get after this month. Do you have some sense it's going to be less than what you've been getting daily of both Moderna and Pfizer?
We have no idea. No information is no information. It could be less. It could be more. It could be zero. We have absolutely no information.
Okay.
Thank you, Jeff. We'll go now to Deanna Durante of NBC 10.
Good afternoon. I'm curious, the CDC Operation Warp Speed just had an update at noon today saying that it wants states, and I don't know if Philadelphia would fall into this category because you are the super site, to not hold back with the 1A category or Q, to go ahead and move on to 1B. Don't hold the doses for everybody in 1A, but keep moving the train going. And if you've got people in 1B, give it to them rather than have vaccines sit on the shelves. How does that affect how you're dosing now, and would you go along with that recommendation if it does impact you?
Well, we've always said that we're not going to wait until phase 1A is complete and everyone is covered in phase 1A before we move on to phase 1B.
Okay.
So we're still at the point where there are many people in phase 1A that we need to vaccinate. As I said, we will probably start with phase 1B at the end of January, perhaps January 25th. It's only a couple of weeks away. And so we are moving as quickly as we can.
And you talked about Philadelphia being ahead of the national average and looking at how the state's numbers are about 33%. The CDC seemed critical of state reporting, saying that the reporting numbers either appear to be slow or that the states and cities appear to be slow in giving the vaccine out, saying that you'll get more doses if you give more doses. So what's your reaction to that, that they're offering what it appears to be an incentive? The more shots you give, the more shots you'll get.
This is the first I'm hearing about that. In the past, they've simply said you're going to get doses on the same as every other jurisdiction on a per capita basis.
Okay. And again, that briefing was just at noon, probably while you were getting ready for this one. So thank you.
Thank you, Deanna. And now let's go to David Melandra of Philly Sports Network.
My question is for Dr. Farley. I just want to get your overall thoughts about how the NBA has handled their situation with the COVID situation, especially what they did with the forcing the 76ers to play with 7 players this past weekend.
The NBA has protocols that they we worked with them on, or we approved when they first set this up. It does require that people who were exposed be quarantined. And I don't know all the details that happened there, but my understanding is that they follow those protocols, which is what they need to do.
And my final one for you and for the mayor is there's a report that the NFL is encouraging all their teams to offer up their stadiums as a mass vaccination site. Would you be open to allow Lincoln Financial Field to be a mass vaccination site?
I'm sorry, that a question for me or the mayor?
For both of you guys. So I want to get your thoughts about that.
Let me just say that we are looking for mass vaccination sites as we try to expand the number of them. I don't know whether we're going to need a stadium or not, but if so, then we appreciate the offer and we'll talk to them about it.
All right, thank you.
Same for me.
All right. Thank you, David. Let's go now to Laura McChrystal of the Inquirer. Laura, you're up.
Sorry, it took me a minute to unmute myself there. First, a question for Dr. Farley. Even if the, cases you said have, this current spike might subside in the next week, why ease restrictions when overall, there is still rising cases? We're not down to where we were in the summer or anything like that.
It's a fair question. There is a downside to these restrictions, which everybody sees. It hurts the economy. People don't have jobs, and it has relations right on down to our increase in homicide rate, which I think is related to that. And so we are trying to strike a balance between protecting people from COVID and limiting the downsides of these restrictions. That's not an easy balance to do, but I think our sense is that things are probably going to get better with the epidemic from here. And so we're trying to allow some of that activity, the economic activity, to take place.
Okay. You mentioned that this winter will still be tough. Do you have any hope that we can get down to much lower numbers, or is it really just trying to stop increases at this point to get through the winter?
Well, I'm optimistic that we will get to lower numbers. So the question is when. It looks like this virus is following the same pattern of other respiratory viruses, and it's worst right around now in January, and it's at its best in the summer. So the tendency is for it to get better from here, but I can't give people a sense of how quickly that's going to take place.
Okay. And lastly, on the vaccine for this next group of people to be vaccinated, how will they register to get the vaccine?
Well, there are different groups there. There are people who are essential workers, and so we'll be contacting them through their employers. And then there are people over 75 who they'll be given directions as to where they can go and just show the fact that their birth date. And there are other people who have medical conditions, and they'll probably be referred mainly through their healthcare providers.
Okay, thank you.
Thank you, Laura. Let's go to Jack Tomzik of the Metro.
Yes, thank you. This is for Dr. Farley. I know you've been asked this question previously regarding indoor dining, but are you planning to partake in indoor dining when it opens up next week or in the near future?
No, I'm not. The case rates are too high, and I'm concerned about the risk.
Now, do you see how some people could see that as a contradiction? Maybe, what do you think? Why are you opening it, even though you maybe think it's not safe for yourself or for other people?
Well, there are people who want to do that, and if people who want to do that and they want to take all those precautions and assume that there's some risk, we're going to allow them to do that. We're going to try to minimize that risk, but that doesn't mean that I see the value of eating there being worth the risk.
All right. And then last question is just, kind of what Jeff Cole was saying about the plan report on today to release the second doses. I believe federal government's also going to recommend that people over 75 be eligible. How would that change your plan?
I didn't quite catch that last question. Can you repeat it?
Yes, in that federal plan to release both doses, I also saw a report that the federal government's going to ask that people over 65 be, inoculated immediately. What is your response to that? Do you think that could be done?
Well, I believe that there are some states that have done that, at least a couple of states, and I have real concerns about that. That if you say anybody over the age of 65 can do this, then it essentially becomes first come, first serve for people over 65, of which there are very many. And if you do that, then the people who tend to get vaccinated are the people who have the most resources. The people who can really work the system or have lots of time on their hands. That's not the way that you save the most lives. There was a reason for the priority system, and that is to try to save as many lives as possible. And this was worked through by a lot of committees that thought about many different factors. And so I do think that there needs to be a priority scheme. So I don't know the full details of that report, but we believe in the idea of having a priority ranking that's built around how do we save as many lives as possible.
Great, thank you.
Thank you, Jack. Let's go now to David Murrell of Philadelphia Magazine.
Yeah, hi. First question for Dr. Farley. Just looking at the latest data, and this is something you discussed last week as well, but the racial breakdown, it looks like Black Philadelphians still only constitute 10% of vaccine recipients, whereas white people are still well over 50%. Question is, I'm wondering, what does the city see as its role in convincing people to get the vaccine? I mean, there are many people who need to be vaccinated. Is this something that the city is actively, taking responsibility for, or do you view this more as the job of, say, the employer who's doing the vaccination in the 1A phase or whatever it may be in the 1B phase?
I think it's an obligation for all of us. I don't think anybody feels that it would be right to have a population that already has many other problems and many chronic diseases than also to be under-vaccinated. Now, you can't force people to be vaccinated, and you can't persuade people that you're trying to force them to be vaccinated, or they may just resist more. But I think we all have an obligation to really make sure that it's available, make sure people really understand what the risks and benefits are, and have plenty of conversations so that we can encourage high vaccination rates amongst the people who are African American and other minority groups. I think those conversations are taking place at hospitals now. We've had good conversations with the hospital's chief medical officers about how to do that. We're going to continue to work at our level to see what we can do to make sure that people who have the most disadvantages have opportunities to be vaccinated.
Yeah, I mean, could you share, sort of what specific things are potentially are being done to, have those conversations? And I'm also just curious. I mean, for instance, if there's any city effort to reach out to people who initially had expressed either, not a negation per se, but on the fence, not making an appointment affirmatively.
Right. So first of all, right now we still have a pretty limited group of people who are eligible for the vaccine, just healthcare workers. As we get out to being more available to the general population, we will be doing more things that involve community leaders, and probably will have a media campaign that promotes vaccination. We don't want to do a media campaign promoting vaccination for any population right now because the vaccine isn't available, and it would simply frustrate people. However, for those settings where the vaccine is available, there are conversations about having people who are look like those who are reluctant to get vaccinated and have been vaccinated, have them talk about it and talk about their risks, and have continued conversations so that people who are initially reluctant, after they see their peers being vaccinated, if they change their mind, they can still do that. And then really listening to what people's concerns are and responding to that what you're hearing. It's not so much necessarily us telling people, is that I think it is listening. That takes time. I do think this will improve over time, but it does take time for people to have multiple conversations and really understand the risks and benefits and see what happens to others.
And just final question, does the city have any sense of how much federal funding it will be receiving for vaccine distribution from the latest stimulus package? And then I get sort of related to that, is there an estimated cost of distribution for the 1B, C group for the city?
Right, so the federal relief package that just went through, we were told last week that there was an allocation in there for vaccination for the city of Philadelphia of $14 million. We have not received that funding yet. We don't know what strings are tied to that, what requirements are attached to that, but that was the number that's in there. And that's approximately what we estimated it would cost us for the entire vaccination initiative.
In the 1BC group?
No, for the entire...
For the entire thing. Okay, got it. Thanks.
All right, thank you, David. And let's go to Mike Donofrio of the Philadelphia Tribune.
Okay, I think I'm unmuted here. All right, I guess this is for the mayor. I've heard that health department inspectors are receiving some threats as they attempt to conduct compliance inspections, and especially health department employees who are women of color. How is the administration addressing this?
Well, we're trying to, in situations where we think they're going to run into trouble, we would like the police to accompany them. We're in an environment in this country where everybody's angry. Everybody seems to be nasty. Trying to keep our people safe as possible, and police, when necessary, will arrive. We'll meet them there and conduct the inspection. And if people are too out of hand, they're going to get locked up.
And do you foresee any additional, or putting in place any additional consequences to those restaurants or businesses that do threaten, city employees or inspectors who are just trying to do stuff?
If you threaten a city employee, you're going to get locked up. It's threats. I mean, I don't know what. Other than locking someone up and prosecuting them, I don't know what else we could do. To expand state law for criminal purposes would have to be done on the state legislature. We could probably increase fines, I guess, but I think the presence of police usually shuts up the big mouth in the first place.
Okay. All right. Thank you.
All right. Thank you, Mike. Let's go to Hannah Chin of WHYY.
Great. Great. I think this question is probably for Dr. Farley. I think following up on your answer to Jack's question earlier, as the city prepares to move into phase 1B and then towards the general population, I'm wondering if you can provide a little bit more detail about how equitable access to vaccinations will be managed in terms of, I know online signups, for example, would require reliable internet access, or other signups would require some form of language and location access, particularly as we open this up to no longer just healthcare workers. I'm wondering how you're planning to manage those barriers. You mentioned possibly including community leaders further on down the line, but will you partner with city organizations or nonprofits to increase that access? What's the plan there?
Yeah, initially, of course, we do communicate to people through email and text, but we'll have to look into ways for contacting people by phone numbers that we don't have, other ways through means other than that to contact people, and they may come for certain populations. It's publicly known that people can call a certain number and make an appointment, be vaccinated. We're going to have to use multiple different strategies.
Okay, but there's not a plan specifically in place around what those might look like yet.
Let me see, Dr. Carolyn Johnson is with me here. I'll see if she has anything more to add about ways we'll be reaching out to different populations.
So I think we're very dependent on working with partners and community agencies to identify vulnerable individuals who might not have as ready access to the internet and to sign up. So a lot of this work will be community-based and driven by the organizations that represent those communities.
Okay. Thank you, Dr. Johnson. I guess my second question would be, how are you going to determine, especially because Philadelphia is determining eligibility a little bit differently than the rest of Pennsylvania, wondering how you'll determine individual eligibility. Will residents who, for example, qualify within phase 1B now in Philadelphia, but not in, say, Montgomery County, will they need to provide proof of Philadelphia residence, et cetera, in order to get the vaccination if they wouldn't be eligible somewhere else?
So we are not requiring proof of residence now to be vaccinated. We're trying to have this be as streamlined a process as possible. If we try to require too much documentation, then we'll be slow getting the vaccine out. So yeah, we're not going to do that.
Okay, and I guess along those lines, I'm wondering how you're planning to manage the fears of those who might be scared or worried about coming in to get the vaccine due to immigration status or other things that might make them kind of more vulnerable. Are you going to manage those fears?
As far as immigration status, let me be clear that the vaccine it's free, it's eligible to everyone. No one has to show any documentation that they are, that they're a Philadelphia resident. We don't know that they're whether they are a legal immigrant or not. We want to just dispel that fear. This has nothing to do with documentation status.
Okay, thank you.
Dr. Johnson, did you have anything you wanted to add on that topic since we have you today?
We've already been approached by some of the clinics that serve the undocumented residents of Philadelphia, and they're very willing to vaccinate their population, and we're very happy to give them the vaccine to do it. So I think we'll be able to actually meet that need in the city.
Great. Thank you, Dr. Johnson. Thank you, Hannah. Let's go to Maggie Kent of 6 ABC.
Hi, guys. My question is in regards to large vaccination sites.
Maggie, hold on one second. You just got muted again. Try it.
Hi there.
There. Go ahead.
Will we be seeing a return of the site at the convention center? Will we be seeing large vaccination sites? I know that New York, LA, San Francisco, they're planning on doing 24-hour vaccination clinics. What's the large scale infrastructure that you have in place right now? I know there's a lot of, we're looking at this, we're thinking about that, but is there anything on the books right now?
I'm going to let Dr. Johnson answer about whether they have anything scheduled we can announce today. But, again, I will point out that we are above those other cities and most of the states in the nation as far as how much of the vaccine we made available. I think we've done fairly well so far, and we'll make as much progress as we can with our own system. But Dr. Johnson, you want to talk about whether we have any other mass
Sure.
scheduled to talk about?
Mm-hmm. And I think that last point is important in that it is not the administration of the vaccinations that's the limiting factor right now. It's the amount of vaccine. So we could run 24/7 too, but if there's no vaccine to give people, that doesn't help anyone. So yes, we have another mass vaccination event scheduled for this weekend, and we are putting in place a plan where we may have standing mass vaccination sites in various areas of the city. So we are identifying partners who will run these events for us, and we will probably run some of them ourselves as the health department. So I think you can expect to see many more mass vaccination events occurring in all areas of the city and on different timeframes. But again, it's the supply of vaccine itself that limits how much we can do.
Thank you. I just have a few unrelated questions if we do a second round.
Yeah, thank you, Maggie. We're going to go to Johan Calhoun of Chalkby. We have about 8 more hands raised and only about less than 15 minutes, so I highly doubt at this point we will have time for questions on other topics, but we'll see how it goes. Johan, if you could take it away.
Sure, thank you. Before my questions, just to be sure, phase 1 may begin the last week of January, correct? As compared to February 1st, what you announced last week?
I was referring to phase 1B. We are currently in phase 1A. So phase 1B is likely to start right around the end of January.
Okay, fantastic. First question is for Dr. Farley. Last week I asked about the teachers, and it looks like the teachers are now, in fact, a part of phase 1B as frontline workers. What's the rollout plan for educators? Will there be a priority list for ages or grades or schools, like what part of town, or will it be like a first come, first serve through online registration?
I'm going to let Dr. Johnson answer that.
So we haven't made any decisions on how to roll this out within the schools as far as prioritizing certain grades over other grades. We have had discussions that have made it clear that we need to open access not just to classroom teachers, but we have to look at this broadly across all the individuals in a school who are serving the children. So that's going to include people in environmental services and food services and teachers' aid. So we are going to be looking at everyone in the schools who interacts with children, and we'll be including them in the vaccination planning. I would not say that we've had any deep thoughts about whether we're going to be doing elementary schools first or high schools first, and it may not actually be practical to do it that way because we have to figure out when the schools are going to be ready to have us vaccinate. But it's going to be an inclusive plan.
Okay, and for Mayor Kenney and for Dr. Farley, Superintendent Dr. Height, the school board president Joyce Wilkerson, and PFT president Jerry Jordan are all confident that schools, some schools, will see in-person learning this year, this school year, this spring semester. Taking a look at the timing of the vaccinations, how large these groups are, and where we are with confirmed cases, are both you and the mayor on board with with their thinking? And are you cautious in saying, let's wait until summer or fall?
I'm hopeful we could get the kids back at school as soon as possible. I mean, practically, it seems not as assured that it would happen in the spring. But if we can get the teachers vaccinated, get them at a level of comfort to get back into the classroom, and get the kids out of the house, off their computers and in the classroom, I think that's a win-win for everybody and a win for parents and the economy. But that remains to be seen. If it's deemed to be safe and everyone's, that needs to be vaccinated I don't see any reason why not, other than just the length of time we have left before the end of the school year.
Let me just say, that there are, the non-public schools are open for in-person instruction now, and I'm optimistic that we can get the public schools open before the end of the school year this year as well.
Okay, will the student access centers be used at any point for distributing the vaccine?
I'm sorry, say the question again.
The student access centers, will they be used at some point in distributing the vaccine?
Let Dr. Johnson answer that one.
Probably not as a distribution point, because we have to assure that they have connectivity to the data collection system. However, we have had conversations that we need to include the staff who are working at those at the resource access centers in the Parks and Rec facilities, that they are going to be treated as educators and teachers and included in that phase 1B vaccination plan.
Excellent, thank you.
Thank you, Johan. Let's go to Denise Clay Murray of The Sun.
Good afternoon, everyone. And I think I should direct this question to Dr. Johnson, because there was some discussion about the amount of vaccine and whether or not that would determine how often and how many people get it in terms of like a large setting. How much vaccine, I guess, how often do you all get the vaccine? Is it weekly, bi-weekly, once a month? How often do you get the vaccine?
So right now what happens is the CDC uploads a vaccine count on Thursday night. Every Thursday, they will tell us we have this many doses of the Pfizer product and this many doses of the Moderna. And those counts are exactly what Dr. Farley had already mentioned. Then on Friday, we take a look at all of the orders that are coming in from the hospitals and some of our other vaccination providers to see how much vaccine they anticipate they need in the next week. And we will approve shipping to those sites. So a lot of this is all done Thursday night, and then the vaccine gets shipped out Friday and then arrives at the practices or hospitals on Monday. But sometimes the providers will say, I don't want to receive my vaccine till Tuesday. So we're always sort of moving the ball a little bit and trying to work with a provider to get them the amount of doses they need on the day that they need it. So it is a continuous process of vaccine coming in, but we actually get our number and our authorization to go ahead and do ordering on Thursday night.
Okay, and this question is for Dr. Farley. When you break down the numbers of the numbers of cases that we have in the city, you break them down by the people who are confirmed and the people who are probable. The people who are probable, I guess, what happens to them? Do you tell them, okay, you're a probable COVID-19 case, this is what you have to do? And how long after that do you find out whether or not they have the virus, or do they move from probable to confirmed?
Yeah, so if people have the ones you refer to as probable are people who have a rapid antigen test. Those tests are pretty good, but they're not perfect. And our general advice to doctors and testing sites is if the result is expected, then they don't necessarily need to confirm it with a PCR test. So if someone comes in with a fever and classic symptoms, they have a positive test, they don't need to do a follow-up PCR test. But if their test result is unexpected, then we would recommend it be confirmed. If someone comes in with no symptoms, have a positive test, we would recommend a PCR test. If someone, if that happens and their probable test later was tested positive with PCR, then they become a confirmed case, and we remove that from our totals of probable cases. So some of these people will remain as probables, and we never know for sure, and other people ultimately are confirmed. But as far as our recommendations for prevention, what steps they need to do, like isolate, is the same recommendations if they're probable or confirmed.
Okay, and last, and I'm not sure who can specifically answer this question for me, but you know, the topic of the economy and restaurants and how they've been impacted by this comes up at almost every one of these briefings. So I guess my question is, what is going to remain permanent in terms of restaurants and how they conduct business? Like, will people still be able to get cocktails to go even after the virus has subsided? Will there still be more of an emphasis on carry out and contactless delivery? Has the business community thought about ways that they can, you know, do those kinds of things and monetize them to the point where no matter what happens, they're going to be okay?
No, we're not going to be able to answer that question now. We're still really at the peak of this epidemic. And so what happens after it's over, we'll have to deal with down the line.
Thanks, Denise. We have just 5 minutes left and still about 5 hands raised, so we're going to ask you to keep it to 2 questions. Martin Pratt of Philly YBN, you're up.
Thank you. Dr. Farley, can you explain the relationship, or give a definition for my audience, the relationship that the Philadelphia itself has to the CDC? What status is Philly in as compared to other cities?
So the CDC in general works with state health departments in every state in the nation. However, there are a small number of large cities that CDC has a direct relationship with, and that number depends on which disease we're dealing with. And I know that's complicated, but that's just the way it works out. So for immunizations, and this thing is an immunization initiative, CDC works directly with the city of Philadelphia rather than through the state of Pennsylvania. And so we are one of 5 cities that are like that. And I believe the others are New York, Chicago, Los Angeles, and Houston.
Excellent, thank you. And lastly, can you explain a little bit more in depth when you say that waiters and waitresses should wear a face mask and a mask? There are several masks out there. I don't know if you've seen them. There's one popular on Instagram right now that is actually a full cover. It actually attaches itself to the side of your face. And I would think that that would be a lot easier than having a mask on and a face shield. So is that something that the proprietors of these restaurants can ask their employees or by themselves, that it covers them out? It does cover them out. There's no opening around the underneath.
You know, we'd have to look and see what these masks that you're talking about looks like. And what you're looking for is a filter that's over their mouth so the droplets get caught, and then the face shields covers them in case anybody else were to cough at them, they wouldn't get droplets into their eyes. If that achieves both of those, then we would find them acceptable, but I'm not so sure that does achieve the first of those. There are things that are sold out there that may look nice, but they may not really be as effective.
Okay, I'll send you an email. Thank you.
Okay, thank you, Martin. Let's go quickly to Manny Smith of CBS 3. Manny, I just got to find you on the list. I know you're having technical difficulties in raising your hand.
Yeah, I got it to on mute.
Good. Go ahead, Manny.
We just have two questions. I know that there's additional guidance coming up on the website for businesses. It's not there yet, but if Dr. Farley, even for the folks who don't read it and only see it on TV, what specifically are a few of the tips that you would like business owners and those going out to indoor dine to take as additional precautions when they start to go out this Saturday?
Well, the key precautions are that no more than 25% seating capacity, no table of more than 4 people, only a household should be sitting at a table. So people should not be going out to dine with people who they don't live with, because when you're sitting at a table not wearing a mask, you're sharing the same air. Infection can spread from one person to another. And then the guidance to the restaurants is we really want them to take seriously these ventilation recommendations.
All right, and then my second question is having to do with COVID-19, but the Capitol uprising. I know that we've seen some...
Manny.
We've seen some reports of rising numbers.
Manny, I'm sorry. This is limited to top questions on COVID-19.
It's about the coronavirus rates, though. We've seen a couple legislators, now up to 3, report that they are positive after some interactions there. Just wondering if we generally are tracking that in the city, or if there's a concern specifically just about numbers or rising rates from that event.
That event was in Washington, D.C. I don't know how many people from Philadelphia were participating in it. I imagine it's small, so I'm not particularly concerned about that.
Okay, thank you.
All right. Thank you, Manny. And we have time for one last COVID-related question from Jason Laughlin of the Inquirer.
Hi, I'll cram these both in. One is other counties have set up survey and registration portals online for people to find out if they're eligible to get vaccine and then to sign up to get contacted for a place and time to go. Is the city setting anything like that up? And secondly, the city included restaurant workers, food service workers in its 1B priorities, and the state put them in 1C, and was curious why you thought you might want to prioritize those here.
As far as the first question, right now the doses are limited enough and the populations are limited enough that we don't have something planned immediately for on the website, and the populations are pretty well defined. As we move into 1B, we may want to do something like that where the populations are less well defined, and we need to make sure that we can find those people. As far as the second question about why food service workers might be in 1B here and 1C in the Commonwealth, I'll see if Dr. Johnson can answer that.
I wasn't aware that the state was choosing to put food service workers in 1C. I think the intent of the federal advisory committee immunization practices was to include them in a higher grouping, and it seemed to us to be somewhat artificial to not include servers and people working in restaurants. So I think our goal was to really achieve some level of equity by treating that industry as a whole.
Okay, thank you.
And let me add, a server who's working around people who don't wear masks has a lot of exposure, and we certainly want to protect those people from acquiring or spreading the infection.
Thanks very much.
Thank you, Jason, and thank you, everyone. We are out of time for questions. I know there were a few other questions on other topics. Please send them to press@phila.gov. And now we will move to Armando for the Spanish language translation of the mayor's and Dr. Farley's opening remarks.
Palabras del alcalde Jim Kenney para el 12 de enero del 2021. Buenas tardes a todos. Quiero empezar hoy con una muy buena noticia. Ciertos locales de la Biblioteca Pública de Filadelfia reabrirán para ofrecer servicios limitados a partir del martes 19 de enero. Durante la pandemia, la biblioteca ha estado abierta, brindando servicios de manera virtual y para el intercambio de materiales sin contacto de persona a persona. Reanudar los servicios en el edificio nos permite expandir estos servicios en nuestras comunidades. Y sé que el personal de la biblioteca pública está emocionado de poder darles la bienvenida nuevamente a sus usuarios. Ellos podrán prestarse y devolver materiales en los locales de la biblioteca, donde contarán con los servicios de búsqueda y mucho más. Estos también incluyen el acceso a las computadoras, el Wi-Fi y la impresión de documentos. Para muchos habitantes de Filadelfia, las bibliotecas son un punto clave de acceso digital. La disponibilidad de computadoras y de Wi-Fi es siempre una de nuestras ofertas más importantes, y esto es especialmente crítico durante una época de mayor uso de recursos virtuales y digitales. Usted puede encontrar qué servicios están disponibles en cada ubicación en freelibrary.org/digital locations o llamando al 1-833-TALK-FLP. 1-833-TALK-FLP. También quiero dar una actualización sobre los esfuerzos de distribución de comidas de la ciudad. Durante los últimos 10 meses, los sitios de comidas para estudiantes del distrito escolar han distribuido más de 6 millones de comidas gratuitas, mientras los edificios escolares permanecen aún cerrados. Estamos agradecidos por los esfuerzos del Distrito Escolar de Filadelfia, de muchas escuelas autónomas y de otros aliados para garantizar que nuestros estudiantes tengan acceso confiable a los alimentos durante la pandemia. Esta semana nos complace anunciar que el Distrito Escolar ha ampliado el número de sitios de distribución para incluir 39 nuevas ubicaciones. Esto significa que ahora hay más de 100 escuelas en toda la ciudad donde las familias pueden recoger las comidas de los estudiantes para una semana todos los días viernes. Estoy muy contento de que las familias tengan aún más opciones y un mejor acceso a alimentos gratuitos gracias a esta expansión. Recuerde, los estudiantes no tienen que estar inscritos en una escuela específica para recoger las comidas y no se requiere portar una identificación estudiantil para recogerlas. Para ver los nuevos sitios y confirmar los horarios, las familias deben llamar al 311 o visitar fila.gov/food. Y finalmente, como saben, el día de Martin Luther King es el próximo lunes. Con la pandemia todavía en su máxima expresión, este será un día de Martin Luther King como ningún otro. Aquí en Filadelfia, el Girard College servirá como el centro de operaciones del proyecto insignia de la región. Se realizarán allí muchas actividades, entre ellas las pruebas COVID. Global Citizen, en asociación con el consorcio de Black Doctors COVID-19, está liderando estas pruebas sin cita previa en el Girard College. Nuevamente, esto tendrá lugar en el día de Martin Luther King, el lunes 18 de enero, desde las 9 de la mañana hasta el mediodía. Las pruebas se dirigirán específicamente a las comunidades desatendidas. Y en el verdadero espíritu del día de Martin Luther King, los médicos, enfermeras, trabajadores de primera línea, hospitales y voluntarios van a ayudar con las pruebas. También realizaremos capacitaciones virtuales para aquellos interesados en servir en el cuerpo de reserva médica. No es demasiado tarde para registrarse, así que vaya a mlkdayofservice.org para obtener más información. Y esta es la actualización en materia de salud para el día 12 de enero del 2021. Hay indicaciones de un aumento de los casos de COVID-19 por las festividades. Hay actualizaciones sobre las vacunas y los planes de vacunación futuros, así como comentarios sobre el relajamiento de las restricciones del plan Más Seguro en Casa. Comenzamos con las cifras. En cuanto a los casos, tenemos 637 nuevos casos confirmados por las pruebas PCR. El total confirmado hasta ahora es de 98.215 casos. Hay 181 nuevos casos probables por la prueba rápida de antígenos. Hoy recibimos un gran número de resultados, más de 15.000. La semana pasada, del 3 al 9 de enero, recibimos un promedio de 584 casos por día por las pruebas PCR y antígeno, hasta ahora, y el 8,6% de las pruebas dieron positivas. La semana previa, del 27 de diciembre al 3 de enero, el promedio había sido de 491 casos por día, con un 8,9% de pruebas positivas. Entonces, vemos que hay un aumento en los casos, pero que disminuye el porcentaje de positividad, lo cual equivale aproximadamente a lo mismo. Se realizaron más pruebas después de las festividades, y vemos aumentos continuos de los casos en las áreas circundantes, en Pensilvania, en Nueva Jersey, en Nueva York y en los Estados Unidos en general. Todos experimentan un aumento en los casos, probablemente relacionado con las reuniones sociales durante la Navidad y el Año Nuevo. En relación a los pacientes hospitalizados, esta mañana había 616 pacientes con COVID-19 que estaban internados en los hospitales de Filadelfia. Este número generalmente ha ido disminuyendo desde mediados de diciembre. Con respecto a las muertes, lamentablemente hay 37 muertes identificadas con un total de 2.640. Alcanzamos un máximo de 103 fallecimientos la semana del 13 de diciembre y esta cifra, felizmente, parece estar cayendo desde entonces. En cuanto a las vacunas, la distribución va mejorando. Estamos aún en la fase 1A, que comprende a los trabajadores de la salud y a los hogares de ancianos. Hasta ayer, 50.529 personas han sido vacunadas en Filadelfia. Esto es aproximadamente el doble de lo que tuvimos la semana pasada. 9.600 personas recibieron la segunda dosis de la vacuna Pfizer la semana pasada. Y esta semana se asignaron 9.500 dosis de la vacuna de Moderna y 9.750 dosis de la vacuna de Pfizer. Se nos ha dicho que recibiremos las mismas cantidades semanalmente hasta finales de enero, pero no nos han dicho cuántas dosis recibiremos después de enero. La incertidumbre nos dificulta la planificación, ya que hay mucha gente que quiere saber cuándo estará disponible la vacuna, pero es imposible planificar si no sabemos cuántas dosis vamos a recibir. La semana pasada continuamos vacunando en hospitales y expandimos la vacunación a otros sitios para llegar a los trabajadores de la salud no hospitalarios. Tenemos una clínica masiva para trabajadores de la salud en el Centro de Convenciones de Filadelfia. Allí se vacunaron aproximadamente a 2.500 personas en 2 días. Asimismo, 1.959 personas se han vacunado en los 26 sitios de Rite Aid. 3.732 personas se han vacunado en los 20 sitios en los hogares de ancianos. Con respecto al plan de vacunación, publicaremos hoy en nuestro sitio web una lista de los grupos que van a vacunarse en las fases 1B y 1C. La composición de estos grupos prioritarios ha sido desarrollada por el Comité Asesor de Vacunas localmente. Este grupo está compuesto por más de 40 profesionales, expertos en atención médica, organizaciones religiosas, empresas aseguradoras, agencias de servicio social y organizaciones comunitarias. Para elaborar este plan se tomaron en cuenta los siguientes criterios. Se utiliza como punto de partida de las recomendaciones del Comité Asesor sobre las prácticas de inmunización y se tuvieron en cuenta las características de Filadelfia, una ciudad urbana, una casa de muchas minorías, con altas tasas de pobreza y altas tasas de enfermedades crónicas. El Comité Federal incluyó en la fase 1B a los trabajadores esenciales de primera línea y las personas mayores de 75 años. En la fase 1C, a otros trabajadores esenciales y a personas entre 65 y 74 años de edad, y personas entre 16 y 64 años de edad con afecciones médicas de alto riesgo. Filadelfia tiene una lista similar, pero no es igual. En la fase 1B tenemos a trabajadores esenciales de primera línea, como el personal de primeros auxilios, pero también a trabajadores de supermercados, trabajadores de cuidado infantil y a los maestros. Estas son personas que viven y trabajan en entornos colectivos. Igualmente, aquellos trabajadores que viven en refugios para personas sin hogar o en instituciones de rehabilitación. Las personas con mayor riesgo de enfermedad grave y los mayores de 75 años. Las personas entre 16 y 74 años de edad con condiciones médicas de alto riesgo, como las enfermedades cardíacas y la diabetes, entre otras. La fase 1C incluye a otros trabajadores esenciales y a las personas entre 65 y 74 años de edad sin condiciones médicas de alto riesgo. Las diferencias con la lista federal es la siguiente. Las personas mayores de 74 años con condiciones médicas de alto riesgo pasan al lugar 1B en vez del lugar 1C. ¿Por qué lo hicimos así aquí en Filadelfia? Porque estas afecciones médicas son más comunes en las personas de bajos ingresos y en las minorías. Porque hay tasas más altas en Filadelfia que en otros lugares. Y porque este es el factor de riesgo más importante en la ciudad y es una forma de abordar la disparidad racial en cuanto a la mortalidad por el COVID. Dentro de cada subfase, los grupos están en un orden de prioridad general, pero este no lleva un orden estricto. Debido a que puede llevar mucho tiempo completar un grupo, no vamos a esperar a completar un grupo antes de comenzar con el siguiente. Esperamos comenzar el grupo 1B a fines de enero, tal vez la semana del 25 de enero. La fase 1B comprende a un grupo grande, especialmente aquellos que tienen condiciones médicas de alto riesgo. Probablemente el vacunar a este grupo tomará meses, a menos que se acelere la producción y distribución de las vacunas. Pero no esperaremos hasta que se complete la fase 1B para comenzar la fase 1C. Hemos recibido muchas preguntas sobre cómo se distribuirá la vacuna, dónde conseguirla, por ejemplo. Nosotros tendremos una combinación de sitios, similar a donde ahora está disponible la vacuna contra la influenza. Los hospitales, ahora con personal propio, pero también trabajaremos para establecer clínicas para otros, por ejemplo, con miembros de la comunidad. Las clínicas comunitarias, las clínicas de salud ocupacional para grandes empleadores, por ejemplo, la policía o SEPTA, las farmacias, los centros de atención médica de urgencia, la vacunación in situ en entornos colectivos, es decir, los hogares de ancianos, las cárceles y otros entornos de congregación. Habrá clínicas de vacunación masiva, como aquella que tenemos en el centro de convenciones, y en los consultorios médicos también. Pero habrá límites para ellos, porque solamente si los médicos tienen el equipo de almacenamiento adecuado, porque la vacuna de Pfizer, que es ultrafría, no se podrá usar en muchos. Y los planes aún están en desarrollo. A medida que se vaya implementando, realizaremos actualizaciones necesarias. Mucha gente está ansiosa por vacunarse y con el tiempo, todas las personas que quieran vacunarse podrán recibir la vacuna. Pero con la cantidad de dosis que se recibe semanalmente, tomará meses vacunar a todos. Para todos los que estén ansiosos, les pedimos que sean pacientes. Nos comunicaremos con usted lo antes posible. Para aquellos que dudan sobre ponerse la vacuna o no, podrán ver cómo les va a los demás antes de recibirla. Dijimos que necesitábamos combatir la pandemia y la ola de invierno con las herramientas existentes, mascarillas y el distanciamiento social. Simplemente por ahora no hay suficientes vacunas todavía para frenar esta ola y todos necesitaremos usar mascarillas y practicar el distanciamiento social durante meses, así estemos vacunados o no. En cuanto a las restricciones del programa Más Seguro en Casa, este entró en vigor el 20 de noviembre. Entonces las tasas de casos en Filadelfia estaban aumentando rápidamente. Desde entonces estas tasas han caído en un 33%. De acuerdo al último censo hospitalario, las hospitalizaciones estaban en un tercio por debajo del pico. Esperamos que el aumento actual, causado por las festividades, disminuya ya la próxima semana. Así que vamos a relajar con cautela las restricciones este sábado 16 de enero. Permitiremos que los restaurantes reanuden el servicio en los interiores, con un 25% de la ocupación aprobada para comer sentados, además de otras restricciones, como que el tamaño máximo de una mesa sea de 4 personas y que esté compuesta solamente por miembros de un hogar. Todos deben usar mascarillas, excepto cuando estén comiendo en las mesas. Los meseros deben usar tanto mascarillas como protectores faciales. Y queremos ser enfáticos en esto. El servicio en el interior de los restaurantes se reanudará con un 25% de ocupación aprobada para comer sentados, no con el 25% del espacio máximo de ocupación. La ocupación legal de un espacio es mucho mayor. Por lo tanto, este 25% no es comparable a los límites de ocupación en otros espacios. Se anima a todos los restaurantes a mejorar la ventilación, porque esto ayudará a reducir la propagación del virus en el aire. Pueden maximizar el porcentaje de aire exterior en los sistemas de aire acondicionado y calefacción utilizando un filtro tipo MERV 13 o algo superior. Actualmente estamos trabajando en estándares de ventilación mejorados que se van a requerir para un porcentaje mayor de ocupación, pero esto no está listo aún y los detalles se anunciarán en su debido momento. Permitiremos también que reabran los teatros con un 10% de ocupación máxima. Los requisitos son el uso de las mascarillas y el no ingerir ni bebidas ni alimentos. Los restaurantes no podrán proporcionar entretenimiento y los teatros no podrán servir comidas ni bebidas. Las universidades pueden reiniciar la instrucción personal con restricciones de ocupación y el uso de mascarillas. Y estamos considerando reanudar los deportes organizados bajo techo y lo anunciaremos tan pronto como sea posible. ¿Qué es lo que aún no permitiremos? Los eventos en interiores, las reuniones sociales en interiores de cualquier tamaño. Las reuniones sociales con personas de diferentes hogares, porque estas son las principales formas de propagación del virus entre los hogares. Queremos advertir que es posible que se restablezcan las restricciones si aumentaran las tasas de casos y hay motivos para creer que el virus se esté propagando en esos sitios. Tenemos otra preocupación, los estudiantes universitarios que regresan a Filadelfia cada otoño. Vimos un aumento en los casos a principios de septiembre con la llegada de los estudiantes universitarios, porque tienen muchos eventos sociales y nosotros no queremos que esto se repita ahora. Por lo tanto, estamos trabajando con las universidades para tratar de prevenir reuniones sociales entre los estudiantes de cualquier tamaño. Queremos que ellos entiendan que esto es por su bien, por el bien de la ciudad. ¿Qué debería hacer la gente ahora? Primero, quiero aclarar que la vacuna no nos ayudará a superar esta ola de invierno. Todavía necesitamos usar las herramientas que ya tenemos a nuestra disposición. No se permiten las reuniones en interiores. Las reuniones sociales en interiores son las peores en cuanto a esparcir el virus. Por favor, no realice fiestas y no invite amigos a su hogar. Esto incluye las fiestas de pijamas para los niños. La comunidad no implica inmunidad. Evite viajar, porque cuando viaja se junta, directa o indirectamente, con los demás. Y si debe juntarse con otras personas, hágalo al aire libre usando las mascarillas. Y no olvide utilizarlas en todas partes, porque solamente juntos vamos a poder superar esta pandemia. Muchas gracias.
Thank you very much, Armando, and thank you everyone for joining us today. That concludes our press availability on COVID-19. We will resume next Tuesday, January 19th. Thank you.